We're rolling. All right, take two. Why? Because the light went on and my beard started ruffling the mic. So we're going to redo it again. So this is my first time actually doing like a podcast-based video. I used to love like quick, real talking videos, which is really good for me. But as the brand is growing, I'm more trying to invigorate and move forward. And if you don't, what's the word I'm looking for? It's just left my head. If you don't initiate, no, well, if you don't, oh God, it's left my head. It'll come back later. Jacob will edit in somewhere. But yeah, we're here with the lovely Sonali, who's the newest member of the Primal team. She's been a practitioner for many years. She's actually doing her second degree. Not a lot of practitioners have 2 degrees. I've known her for a long time as well, which is really interesting. We'll get into that story as well. But I'm going to give it to Sonali to take it away. And if I butt in or interrupt her, I apologize.
He does that a lot, by the way.
So, wow, thanks. Thanks.
Hi, guys. My name's Sonali, as you probably know. And I am so excited to be here with the new Primal women's team. Little branch off. Oh, yeah. Show the badge. Always get the badge.
Behind us as well. Yeah, so yeah, branding everything.
Yeah, so as Corinne said, I'm in my second degree. We're just about to finish my second degree. I've been a practitioner for over 5 years. I've dabbled in it all. So my first degree was sports rehab, exercise science, got that MSK knowledge on lock, lots of sports massage, lots of pitch side.
Pregnancy massage, working with athletes, working with stroke patients, Parkinson's patients. I've kind of dabbled in it all, neuro rehab, respiratory rehab. And then I decided that still wasn't enough. So I went and trained to be an osteopath, and a lot of people are like, huh? Like, what's an osteopath? Do you want to crack back?
Do you want to just crack my neck or something?
Yeah.
Honestly, nothing pisses me off more, but this is exactly why we're doing this, because I want to educate people and let them know that I'm more than just cracking your neck.
Yeah.
And there's actually a lot of graft and a lot of knowledge that comes behind being an osteopath. And it's a protected title, again.
Yeah. No one can call themselves an osteopath.
No one can call themselves an osteopath unless you've done the years of graft like I have. 1,000 clinical hours. But yeah, what an osteopath... What an osteopath actually does. So yes, we are musculoskeletal professionals. We help you with your injuries, prevention, any kind of pain you're in, but also we go above and beyond. So my type of specific training is looking at the whole entire body. So let's use your shoulder as an example. Karen's come in with me, shoulder pain on the right side, started X, Y, and Z. He thinks it's coming from...
just wham, nothing long.
Hitting military press. He thinks, yeah. 9 times out of 10, that pain is coming from a musculoskeletal side of things, tendon, muscle, ligament, articular surface of the GH, right?
Yeah.
But that 1/10, I was going to say 1/10%, whatever, my maths ain't great. That 1 in a 10 chance is that pain could be coming referred from somewhere else. And this is what a lot of people don't know. So like your liver and your gallbladder can refer pain to your right shoulder. So it's my due diligence in our sessions to make sure I'm screening for all those things to make sure that your pain is truly coming from where I think it is coming from.
Yeah, totally. I think a lot of people just think, like what you said, it's the initial reaction. I've hurt my shoulder, let me massage it.
Yeah.
And they'll go for 3-4. The basic lifestyle of any patient before they come and see us is, I've hurt my shoulder in the gym. I rested it for 2 weeks. I thought it'd be fine. I got a couple of massage sessions. It was a bit worse after massage, but that was expected because no pain, no gain. Right? And then they go back to the gym and they're like, oh, the pain came back again. I rested for another 2 weeks, and it's been like 3-4 months, and this cycle keeps happening. Like I said, 9 times out of 10, yes, MSK, but there are elements where it might not be. And I've got a patient right now. She is a 74-year-old lady. She's heavily diabetic. She's not regulating her sugars. She's broken her forearm. She had a lot going on. Long story short now, her shoulder testing is fine. Full range, everything. She could do everything. She's got strength, everything. But the only thing she can't do actively by herself is just going past here to here. But once I do it past the memory that she's all good. And we know with diabetic patients and sugar issues, there is a unknown known phenomenon when they have like shoulder-based injuries around sugars. And I'm digressing a bit, but it's back about Sonali. So introduction. Sorry.
See, we can go off on a tangent, and I was going to add to that. I mean, looking at her age range, I'd look at her estrogen levels, issue on HRT. So as osteopaths, we need to know everything. I need to know all the medications that you're on. I have a basic understanding of those medications, how they influence the body. Could your pain be coming from side effects from your medication? Another thing, comorbidities. You talked about diabetes. We know there's a link between diabetes and frozen shoulder in women 50 plus. Things like that. And that's where osteopathy is a little bit different to kind of your average physio or sports therapist or sports massage therapist, is that I know that extra bit deeper, And it works out because in this day and age in healthcare, I mean, how long are you waiting to get a GP appointment?
Oh,
impossible, right?
Yeah.
And when you do get the GP appointment, how much time are they spending in with you? 5 minutes?
I spoke to my client. He's actually a GP down in Pinner, and he was telling me how they have 15 minutes max per day, per client per day, and they have to do something like X amount an hour.
Yeah.
And I was like, by the time you start chatting, you have to be out the door.
Exactly.
And this shows how stressed the healthcare system is here in the UK.
Yeah.
And I think the difference here with osteopathy and what we do, and most clinics anyway, you pay for that extra knowledge, that extra time.
It's the value. Like, we want to show you that actually this is very valuable stuff.
Yeah.
Like, a lot of the time when it comes to issues like this, we are the first people. Like, I work in a community clinic. I'm the first person this person is seeing about this issue.
Yeah.
Right? And in, like, my case history, I'm doing a general screening of the entire systemic
everything.
Thing. I'm talking cardiovascular, respiratory, neuro, everything. I'm looking at everything. Even your headaches, you think, oh yeah, I'm just a bit stressed. My headaches are coming from stress. I mean, we're here to screen everything. And I will probably gauge all of that information in that 45 minutes way better than you sitting in your GP for 5 minutes telling you, oh yeah, sorry, you can only tell me about one problem today.
Yeah. And you're totally right. I think that's the slight problem. I think with a lot of the population of people, private practice can be expensive. Literally, it can be expensive, but a lot of people don't see the value in what we can do.
Yeah.
Another patient comes to mind. Lovely guy, been training for years, very in shape. We see him, fantastic. He was having this pain. Anyway, found out that he had, oh my God, I'm going to butcher it. The lateral something. I'm going to butcher it. I'm not going to bother trying, right? Basically, the nerve that comes from his lower lumbar into his his medial glute was just pissed off. So when I was doing the spring test, A&P, moving each vertebra, seeing what's going on, when I hit the point, it will just refer pain straight away. And for years, he goes, I have back pain. I'm like, no, bro, this is not back pain. This is a gluteal-based injury. And I think once he was able to really understand and I was able to replicate his symptoms to him, he was like, he had that like, eureka moment.
It's the education bit. Like, this is why, like, I love seeing patients because they're like, oh my God, I would have never known that. Well, exactly. I didn't go to uni for 5 years.
To not know.
To not tell you about your issues. And that's why you come and see me. Yes, I'm going to help you treat and I'm going to get rid of your pain. But at the end of the day, you need to know why you're in pain.
I'll ask you a question. Did you learn more at uni or through actual application experience?
Okay. This is my take. It's like, I'm going to put the percentage at 30-70. 30% at uni, 70% real life. And this is why with all kind of healthcare degrees like this, you are pushed into placement after placement, hour after hour, being in front of patients because it's real life. Like, it's real life knowledge that you're applying. Yes, you can read the textbooks. Yes, you can look at anatomy diagrams, but it just is not the same unless you are feeling. And this is another thing, because I've been studying and I've been a practitioner for like now 5 years, your palpation skills develop. So like, we are so sensitive, like, the nerves in my fingers, they can feel anything.
Have you got to a level where you can use your elbow when you're walking to feel? Oh yeah,
and that just comes with, again, time, practice, experience. 100%. But exactly why I wanted to get, just to kind of round it up, why I wanted to get into osteopathy is because
we got lost in the passion there.
Yeah, we just see this is what happens. We can yap for hours. Is the fact that yes, the healthcare system in the UK is in the trenches. People aren't getting seen. People are getting diagnosed for things like cancers and stuff a lot later on. People like us can pick that up quite early. Yeah. I'm able to basically refer you to your GP, fast track that process for you, write the letters, get you into the door, and then we can go from there.
I think that's a lot of people don't even know that.
Yeah, so osteopaths, I'm able to write you referral letters and send that straight to your GP.
And can you refer for scans and stuff as well?
Yeah.
So I think now like I said, look, we don't know who's going to see this. Hopefully it goes viral and a lot of people see them. But it makes a big difference to know who you can go see.
Yeah.
You can't see your GP for 2 weeks or 3 weeks. You can't see an osteopath for the next 2 to 3 days. They can write the letter. You can actually tell your practice I had this letter, and that will just supersede things.
Honestly, I've had so many patients in my community clinics where I've had to write GP referral letters to because their GPs aren't taking them seriously.
Yeah.
I've done all the testing. I've written all the results that I found in the testing that I've done in the room, send that off to their GP. They're literally seeing in the same week.
Yeah. It makes a massive difference.
It makes a huge difference. And the thing is, we're like the filter people.
Yeah.
Because do you know what? I'll tell you a crazy stat. 50% of GP appointments are just about back pain. Imagine of that 50%, how much load we could take off GPs, the stress off their backs.
We could do 100% load.
And the thing is, it's just education. This is why this industry is rising even more, because I'm just like, don't go to your GP for back pain. They're going to pop a pill in your mouth and tell you to get on with it.
Yeah.
Sign you off work for 2 weeks and that's it. But that's not solving the root of the issue. That's why I'm just like, ugh.
And I think a lot of the time when it comes, just touching on back pain as well, a lot of people think I need a massage for back pain, or can you stretch me out, or it's coming from my glutes, my core is inactive, and all these things that Instagram has popularized over the years. And I think the main thing is, but because a lot of people say my back's weak. It's not. Like, let's just be real.
Your spine, your vertebrae, your discs are so bloody strong. Yeah. And you know, I hate when people describe them as jam donuts. Like, fuck.
Oh yeah.
Fuck the jam donut. Like, seriously, it's not a jam donut. Your discs are very kind of, what's the word? Like,
solid, man.
They're solid, mate.
They can handle a lot, but we have to also understand pain is a brain's perception of a sensation, right?
Talk about this all day.
I could do this to you, you won't feel it. You could do it to me, and I could be on the floor crying.
Exactly.
And it's
all about perception.
Yeah, and when we're trying to treat back pain or any kind of pain, we're just trying to modulate the brain's perception of what pain is in the area.
Exactly.
How many times have you hurt yourself? And the first thing we do is someone grabs it, or when you're young, you're like, hold it and squeeze it.
Yeah.
Because all we're trying to do is change the sensation going from here to the brain.
Stimulating basically different pathways to kind of distract you from what's happened.
And that's kind of what we're kind of doing, but inducing more of a healing response as well.
Yeah.
To kind of get that. Wait, we've digressed big time. How did we meet?
Okay. So think about me, 16-year-old Sonali, going to the gym for the first time. Yeah. And I see 16 years old. This is when I was probably in about year 10, year 11. And you know, in like year 10 and 11, you've got to do work experience. I'm thinking, where do I want to do work experience? What do I want to be when I grow up? And at this point, I've had already 2 knee surgeries. That's the story I'll get into later on. I'm such an injury prone person. So you're with the perfect person.
The clumsy osteo.
Yeah. So I've had my knee injury, getting back into the gym. And then I see your banner outside the gym. This is in like a leisure centre.
Yeah.
So I'm like, okay, like, why not? Let me just see, like, what's this all about? Yeah. So I literally call Curran. I'm like, hi, my name's Sonali. I'm like a year 11 student doing my GCSEs. And I just wondered if I could come in and like shadow you.
Yeah.
And this is when he was renting just one little room in this leisure centre. This was 2016 or 2015.
Yeah. Before I even started Primal, this is when it was just me by myself doing it.
Yeah.
And this is pre like my little heart episode thing. So yeah, that was a good time, man. That was a fun time.
So yeah, got in. We actually met up for coffee before because you were just like, okay, like what you're about. Are you serious about this kind of stuff? And I mean, I was 16, so I didn't really know what I wanted to do. Yeah. But I was dabbling in like, I knew I wanted to go into healthcare, so I did like radiography, like work experience. I did work experience with Karen. I was just like, where do I really want to go?
Where do I fit in this world?
Yeah, where do I fit in this world? And then so I went in. I shadowed him. I was like, actually, I could see myself doing this. And then ever since then, we've just kept in touch.
Yeah.
Like, you know, we'd catch up yearly or like every couple of months. Like, he would check in, be like, how are you doing? And this is through like me doing my first degree.
Yeah.
Me training to become a Pilates instructor.
Yeah.
Me doing my second degree.
Yeah.
And then
we're here now.
Now we're here. Like, he calls me up, he's like, I really need someone. And I was like, I'm the perfect person.
Yeah, it was crazy because I'm a firm believer that in life, people come to you for a reason.
Yeah.
And look, I meet thousands of people a year. Mm-hmm. And why is it that I choose to keep in touch with certain people more? Yeah. There's a reason why. And I think one thing that drew me wanting to stay in touch with you, because I saw the drive you had when you were younger, and I had the very similar. How many times I've said to you, you remind me of me, that go-getter. And once you're ready, it will be amazing. I think that's why I've always kind of said, do you know what? She'll be a weapon when she's old in terms of the team. She'll be a great practitioner. And I think with the right guidance and skill set, honestly, I think it's going to blow. And I'm excited to see what happens in the next 2 to 3 years.
This is like invisible string.
Yeah.
Like, the string's been stringing since I was 16 and I'm 25 now.
Yeah.
So,
9 years.
Yeah.
You feel old, man. Shit.
So I feel like I'm like the perfect piece of the puzzle to fit into this and kind of help you launch or grow your business that one step further. Because yes, we've got Primal therapy on lock. We've got the MSK side things on lock.
ACL side smashing it. And now we're kind of introducing the women's side of it because that's something I feel really passionate about because I'm just like, okay, I'm a female practitioner. Again, in a man's world, talk about working pitch side, them seeing me on the pitch in my pink little football boots, it didn't go down well. Like, it really didn't go down well. And that's made me realise, like, nah, I need to open up doors for women to feel safe in sessions of like therapy, in like, you know, again, like
it's daunting coming into like a physiotherapy clinic or an osteopathy clinic because you have to undress a little bit and, you know, women can feel uncomfortable. And that's like the first thing that I wanted to be like, no, like I want everyone to feel comfortable.
Yeah.
And then we go from there. But then also, people don't talk about women. I'm sorry, like they really don't. All these scientific studies I'm literally looking at for writing this essay and writing that essay, they're all studies done on men that have just been generalized to women. But our bodies are completely different.
Yeah.
Like our hormone cycle is completely different.
Yeah.
Everything. And the thing is, we're just told, whenever we're in pain, we're just told to like deal with it. But women going through menopause are just told like, yeah, deal with it. Pop a HRT, you'll be good, love.
I actually have a patient right now. She's a lovely lady. I've been seeing her for years as well. And she's at the perimenopause stage of her life. And she kind of got this knee pain, I've got this hip pain, I've got this wrist pain, I've got this, I can't sleep. And I was like, are you going through menopause? And she was like, I don't know, am I? I was like, well, you have to speak to your doctor. But I said, there's no diagnosis. It's just a series of symptoms, which the criteria.
Yeah.
And she's doing, like, she now gets it because, like, the hip pain, knee pain, and she thought she was breaking down. She's not. She's in fantastic shape. She trains 5-6 times a week. And I think it's, like you said, the women's bodies are so different. Most women from the age of 45 to about, 55, will experience, during the menopausal, perimenopausal stage, will experience some level of hip or knee kind of discomfort issue. Greater traumatic pain syndrome, medial glutenitis, or tendinopathy, or something like this along their journey. And I think if we are able to like educate,
exactly, because they don't even know for the reason, like, apart from being like Dr. Google, they don't know what changes are happening in the body during these kind of things. Like, okay, what's happening with the hormone balance? What's happening to estrogen? Estrogen is a really, really important hormone, just not even like for bone health. That's why in women like who are perimenopausal, they come in, oh yeah, I'm getting pain like right there in the middle of my thigh.
Yeah.
Okay, you might be osteoporotic. Your estrogen is dropping. You could have a hairline fracture, you know, things like that. Yeah. And we as osteopaths are trained to basically recognize these things, build a picture based on their lifestyle, and which is why whenever you come into like a consultation with me, I need to know everything. I don't care that your shoulder hurts. I need to know how you sleep in, what's your diet like, are you eating enough protein, are you eating enough fiber, are you drinking enough water, how's your sleep, are you chronically stressed? Because again,
do you think it's like a process like series of elimination?
Yeah.
If we can better the sleep is a massive one. That's a whole different
sleep is yeah.
But if we can slowly better these things, we can have a better overall image.
Exactly, and which is why it's not a quick fix of let me just manipulate this or let me stick a few needles in and let me like, you know, articulate this joint. It's actually, that's 10%. The other 90% is addressing your lifestyle factors.
So Damon on the team, I remember I was talking to him and I think he done a video on it. I don't know if we still have it, Jacob. We might still have it. And he was saying how can I base a 45 an hour consultation on that one click? That he goes that 3-second manipulation doesn't equate to everything else you've done in the last 40 to 45 minutes.
No.
It makes a massive difference because, like you said, the click is. I mean, first we don't chase the clip. That's the only connotation, cavitation. But treatment is a holistic approach on everything. And look, some injuries like supraspinatus tear or biceps tendinitis, it needs rehab.
Yeah.
Not everything can be massaged, acupunctured and stretched and stuff. Some things do need rehab, and I think the best treatment.
I think most things need rehab.
Yeah, 100%. And I think the best thing with the osteos at Primal, they incorporate heavy rehab. Damon does a lot. You do a lot.
Yeah.
Because when I spoke to osteos in the past, they. I mean, even I've spoken to osteos that are still training and say, our lecturers don't like us doing exercise prescription.
Yeah.
You know, it's not something that's integrated. And I think now what's happening is with the new age of osteos coming in who are training,
this is
integrating more rehab exercise based to help like fix the injury, like make it stick better.
Yeah,
I think that's where the industry is going. Yes, there is a big difference in physio and osteo, but eventually it's all going to amalgamate.
It's all going to blend into one. And like you said, the new generation of us that are coming, and especially the people that I've studied with, it's such a different game. Like osteopathy is constantly changing. And you know what? Osteopathy, the only difference is that we just take a holistic approach. We look at everything. Again, back to the shoulder. We're not just looking at your shoulder. I'm looking at, your neck. I'm looking at the joints above and below. I'm looking at the way you walk because you might not think it's relevant, but it's relevant. The way you're sitting in your car, the way you're sitting at your desk. Yeah. We have to look at everything, which is why in these consultations, you might feel like, why is she asking me so many questions? Like this feels so irrelevant. And if it feels irrelevant, ask me, why are you asking this question? And I'm happy to explain. And most of the time I will explain. But I'm just trying to build a picture in my head of your entire life.
Exactly.
I need to know everything. Sorry.
Same thing I tell my clients. I'm trying to paint an image of you in my head.
Yeah.
To understand what you do for your day. How does that work? How many hours are you sitting down? Because then we can understand, okay, this is why you're having pain around the kind of scapula, or this is why you're getting hip pain and it's such and such. So I think, again, understanding your patient dynamic is really big in therapy.
And you know what? Like, nothing is TMI. And is why with women as well, we are not taught, but we're just grown up. Like, any issues, just brush them under the carpet. Brush them under the carpet, like, mask the symptoms, mask the pain, you carry on with the day. And we see that a lot with mothers as well, right? Like,
your mother, you got to carry on.
Yeah, exactly. Like, continue through it, push through the pain, or like mask the pain because there's other priorities in life, like my kids, my husband, this, that. But no, when you're within the room with me, you're the priority.
Yeah. So sometimes a lot of people do come in the clinic and sometimes they start offloading.
Yeah.
Oh man, I got this going on and this. Oh, my parents is at my house. This. Oh, and this. I lost my dog and this and this.
Yeah.
But then sometimes as a practitioner, you have to learn to listen.
Exactly. But the listening actually helps me build the picture more of them. And then, like, let's relate it back to stress. Who's not stressed these days? Who's not stressed? And that's just as the world is evolving, things are more stressful. Life is getting more expensive, you know. Can I buy a fucking house? I can't, right? Yeah. Everyone's stressed, but it's about how to manage that stress. And that's where, again, I can come in. By painting a picture of you, I'm able to see, actually, why don't we try this? Like, okay, have you thought about diaphragmatic breathing? Have you thought about maybe doing a 10-minute walk in the morning, getting the sun in? Like, things like that. Because when you are chronically stressed, and this is where patients come in, they've done like 5 sessions and they've seen like a 10% improvement. And the reason is not because I'm shit at my job. Yeah. The reason is because it's these lifestyle factors that are stopping this from...
Okay. Have you ever had a patient, right, where you've done 2-3 sessions and they're like, oh, no difference. I'll be like, okay, but you said you're able to lift up the thing off the shelf and you're able to carry your son and you're able to this and you actually mowed the lawn the other day. Exactly. Oh, and you went shopping and carried the bags from the car. And you did this and this. And actually you went for a little workout.
Yeah.
But there's been no difference.
So this is why with every patient that comes in and I see them for the first time, my outcome measure is something called the patient functional... I don't know the abbreviation, but it's basically asking the patient, what activities are difficult for you now? Oh yeah, reaching up to get my mug out the cupboard or pouring the kettle. I'll be like, okay, rank that on a scale from 1 to 10. How difficult is that for you? Okay, it's about an 8 right now. Come back next week, you ask them the same question. They've even forgotten that you've asked them that question and they'll come up with a different number.
Yeah.
And that's the way we track progress. And they don't realize that, oh my God, I didn't even think about that. Because it's such a mundane activity in their life. It's not like I'm running a marathon. Oh yeah, I could do that last week.
I had a client, chronic knee pain for a long time, done some rehab and stuff. And I said, look, go for a 5K run, see how we're getting on. End up doing 2 10K runs that week.
Yeah.
And they're like, oh yeah, I'm still getting knee pain. I said, but you ran.
You ran.
Okay. So it's also, I think what happens in the social media world is you have a problem, you come in on day 1, you get cracked, whacked, spun, everything, and you're fixed, magically done in 1 session.
Yeah.
Yes, there has been times when it's happened.
Yeah.
You know, there
of course
has been there's been hundreds of times where a patient comes to me one time and it's been a one-hit wonder and they're all good. Wicked, right? Yeah. But there are patients that are like, oh, my friend said he saw you for 2 sessions and his back pain was gone. And I'm like...
And then the expectation is set there.
Yeah, and that's the problem.
Yeah, which is why, I will always set my expectations with the patient. Like,
straight away, you have to. And he was like, my mate saw you for 2 sessions, back pain was all good. I was like, yeah, sweet, fantastic. Yeah. And anyway, he had a QL issue, easy, that's done. This guy came in, I said, look, with pains, shoulder pain, knee pain, back pain, there's so many things that go in and out, ligaments, tendons, and such and such. So the pain patterns can be quite similar, but very different. Anyway, screened him, lumbar instability, retrolithesis. Yeah. So complete different.
Such a different issue.
Like complete different. So but the pain was similar. Yeah. Right. But again, a treatment outcome and managing expectations is huge. Like I said, if you have a really stressed patient who's a mum and she's doing this and working and in my head, I would love to give you 3 rehab exercises. I'm going to give you 1. Yeah. And sometimes you see patients, they're like, he chatted to me, he worked me for 40 minutes, he gave me 1 exercise. Yes, because you've got so much going on. I would love to give you 3, 4 exercises.
Oh, yeah, of course. But, in an ideal world. But we're tailoring everything to you, what you can do in that time. Yeah. And like, again, I just keep talking about stress because I just can't get over how much it impacts like people. Like you said, okay, you've seen me for 2 sessions, everything is going great. Then suddenly the pain comes back up, right? And again, I set my expectation, flare-ups are normal. Yeah. You might have been particularly stressed that week because of something. And what people don't know, so stress hormone, cortisol, released, if that's your like fight or flight hormone, and that's released in periods of stress. Now, if you're stressed all the bloody time, that is being secreted into your bloodstream constantly. So your body is constantly in like a fight or flight.
Getting chased by a tiger,
yeah, literally. And when that happens is that your body will shut down all non-vital processes. So that will stop your body from producing like the anti-inflammatory cells that you need to combat inflammation or things like that. So that's why I'm saying, like, flare-ups, they're normal. And again, a good practitioner will make their patient aware of that.
Do you know what? I'm going to tell you exactly what I tell each patient when I do acupuncture for the first time. Dry needling. I said, look, I'm looking for 2 outcomes. If I needle it and it's worse, tell me. We go straight into exercise prescription. If I needle it and it's better, I'll repeat 1 more time. Then I'd start exercise prescription. But that little 2-second caveat, that because a lot of time when patients come in, fuck, I was fucked for 2 days. It's horrible. I'm worse and this and this. 3 days later.
And that scares them.
Yeah.
Of course it would. But again, if you set the expectations.
Then the treatment outcome, if you don't set the expectation, is like, I was horrible. He really messed me up. How many times I've seen people that, I went to a guy and he completely battered me, ruined me, or this and this. Maybe they set the expectation. Maybe they did the wrong treatment. Who knows? But back to what I was saying. Once you're able to kind of set that boundary and expectation, if I do this, this will happen. And if I do this, this doesn't happen, but this happens, we're all good and we carry on. And like you said, people have a better experience, a better outcome. And then we just see the results getting better and better. Then we get the good 5-star reviews, which we like. And then we get more referrals, which we like. And then we just keep going and keep going and keep going. Snowball effect, right?
Exactly. And I think that's the most important thing. I think that's the ethos here that I've seen. Like, you know, I've shadowed everyone. Everyone, like, this is what's nice. Everyone has their own individual way of working. Like, we would work differently. We've worked together in the same room. We're seeing the same patient, but we'll still take slightly different approaches. But as long as you can justify what you're doing, why you're doing.
It makes a difference. And I think the main thing is you're patient-centered. You want the patient to get better. So like you said, I mean, I had a patient and he's been with me for years. Maybe there's also a thing that happens with practitioners when you're over familiar with your patients. And I was just looking after him and I spent a couple of days watching Sonali and he's got a lot going on. Then I said to her, do you know what? He needs a diaphragm check. I don't know how to do that. I'm not trained in that properly. She's done Pilates. She's got the accolades she can. And I'll happily refer over to Sonali because she can handle that. And I said to her, I think he needs a diaphragm, blah, blah, blah. So Sonali showed me how to do it. And I was like, okay, sweet. We got this. Done it. He felt so much better. So much better. Even our patient we had, when she came in with neck pain and when you checked out her ribs, I let you handle the session, and through rib mobilization and just kind of getting her moving better, she was like, I feel so much better now. That was a great session.
I want to be known as the diaphragm queen because so many issues go unresolved just because of the way someone is breathing. Like 85% of us are probably breathing completely wrong. And again, this is a video that we're going to actually film on today because I'm just so passionate about it. And I'm just like, guys, breathing can take you a long way. People don't realize your rib cage is actually connected to your thoracic spine, which is your mid portion of your spine. We're talking about people from work from home. You're always in this position. People who sit in their cars a lot, they're always in that position. How is that impacting your ribs? How is that impacting your breathing? How is that impacting the way your lungs are recoiling? How is that impacting the way you're getting oxygen into your body? That, again, is a barrier to healing.
Yeah. And I remember when we were talking, I think a couple of years ago, I was talking to one of my ex-colleagues and he done a CPD about how, like, the QL, the lower thoracic fascial connections go into like the rib cage. And how it all works. And he's seen people that have like lower back pain and poor diaphragmatic movements, stuff like that.
Because that QL muscle, one of the key muscles that will always
most commonly back pain injured muscle, the QL.
Is the QL. Anytime your back goes into any kind of trauma, the QL will be the first one to step in and try to save the day. So in the process.
Save the day, I like that.
Yeah, it does. Save the day, gets inflamed or irritated in the process of that. And no one thinks about the ribs. Well, it attaches to the 12th rib.
Yeah. It makes a massive difference.
And this is where, like, again, okay, we talked about 70-30% of how much have you learned in anatomy, how much have you learned in clinical practice. If you don't know the theory of, like, you know, muscle attachments, this, that, what does this do, what does that do, then again, you can't.
Oh my God, I had a patient that came in last week, and he came in for a trapped nerve in his neck. And so in my head, neck, trapped nerve. He walked in hobbling. I said, what the hell have you done? And he was like, oh, my back spasmed. And I was like, bro, he came from very far. It took him 2 hours to come see me. I said, bro, I said, did you just do it now? He goes, as soon as I parked up, got in my car, my back went. And I was like, bro, I shouldn't touch this now.
No.
I need to leave this. But he's like, come on, please, I've come so far. And I was like, bro, clinically and through my experience, I'm like, if I do this, it's going to be worse.
Yeah.
He wasn't having it. And I said, do you know what, bro? Fine. So I done bro, base. I didn't even do hands-on. Needed it for 15 minutes, right? And I was like, bro, if I'm going to be honest, like that's all I want to do, because I said, you've just done it. Whenever you injure yourself, give it 2-3 days to see what happens. Don't panic. Say, Conor, are you free? Can I see you now? Just wait, because 9.5 times out of 10, it's going to be worse if you get touched or treated ASAP.
Because again, that's just the times of like tissue healing, right? 0 to 3 days, you're in that acute inflammation phase. Your body's trying to step in and help you, let alone us coming in to help you. Right?
Yeah, 100%.
Let your body do its thing. There's a lot of processes underlying that are going on. I mean, I'm not going to talk about the science of it, but it's happening. It's happening. Let it happen. 3-4 days later, that's when you want to come in and we start really just assessing, treating.
Yeah.
And a lot of the time I get acute patients where I can't even get them on the bed.
Yeah.
I can't even assess them because they're so acute. And I'm like, just, take it easy, take a rest day. Yeah. We'll go from there.
Yeah. Again, this guy, and I said to him, I'm going to needle it today. You're going to be horrible for the next few days. Long story short, he had to call 111 on Sunday. He thought he was dying, and then he called me and said, bro, you're not done. I told you this will happen.
Yeah.
Yes, call me a bad practitioner and blah, blah, blah. But there was a few more factors into it. We worked on his other stuff. Anyway, long story short, GP, sent diazepam, banging, he was sorted in a day. Fantastic. But I said, with a muscle spasm or any of these injuries, you never want to treat it on the day. Your body's the smartest thing.
It's so clever.
It knows what it needs to do. Sometimes, yes, it can give us pain and be uncomfortable for us, but ultimately it knows what it's doing.
It knows what it's
We are the adjunct. We are the people that come and say, do you know what, body, chill out. Or, do you know, let's just start healing in a better way. Or let's move this joint better so we can facilitate a better range of the joint, so then your brain perceives pain differently. And then healing starts to kick in. Instead of just, I'm in pain, do this now, and we're fucked. And I think that's where a lot of practitioners may get lost in the sauce, because they're so desperate to be, the practitioner, god or queen, or I treat everyone, I do all this. Sometimes you've got to take a subjective approach, be like, is this the best benefit of this patient? I must stress, this patient is a friend.
Yeah.
He's like, he lives on my road. Well, back then when I live far away. And that's why, like, he was cool with doing it.
Yeah.
But if somebody that
the one thing I got from that conversation is education. Just educating them, letting them know that, okay, this is normal. Like, again, I didn't go to uni 5 degrees with 5 degrees.
Well done.
I wish. I'll do a PhD next.
Some research.
I didn't go and study all of this to give you incorrect advice. Do you know what I mean? Again, every person is different. We take every situation for itself. But especially when it comes to acute pain, like, your body is the one that is doing all the work at the beginning. Like, just let it do its thing.
Yeah.
It's very clever. I mean, we speak about compensations and things like this all the time, right? Your body is clever. If something is not working properly, say in your foot, your knee's going to work a little bit harder, your hip's going to work a little bit harder. Then what happens next? Your lower back's going to work a little bit harder. And this is why with osteopathy, but again, everyone here at Primal, we look at everything. Like, I'm looking at you from the minute you're walking into the door.
I'm walking just you for the car park.
Yeah.
What are they walking? Oh, he's bending to one side.
I'm already building that picture in my mind, and I have not said 2 words to you.
Yeah.
And this is why you feel like we are giving value. Like, yes, slapping down £110 or 80 quid or whatever on a thing, like, oh my God, it was only 45 minutes of my time. But I was starting before that 45 minutes started.
Yeah. And after.
Yeah.
Writing notes and everything, getting it all done and thinking, okay, how's their response, and checking in. There's a lot that goes on in therapy. Like, I remember when, I can't remember what patient it was, me and you were with them, and we were saying, we have to check for cancer, we have to check for this, we have to look at this, we have to see this skin change, this change, we have to look, just so many things we have to monitor, skin tone changes, what else? Fuck it, it's not coming to me now. But there's so many things you look at a person rather than, my pain is there. Okay, so what's going on? Is it ligament based?
Exactly. And like with my fresh degree, screening, cardiovascular screening. I have a pink stethoscope, yeah? I can listen to your heart sounds if I really needed to and if I really wanted to. But most of the time, I will just refer you to the GP if I can screen your cardiovascular system. Yeah. Same thing with respiratory. Again, ribs, lungs, that comes into a lot of musculoskeletal presenting issues. Yeah. What else? Neurotesting. Oh my God, how many neurotests? Like, everything. We look at everything. Cranial nerves.
Oh my God. Now, yeah. So I had a patient here, shoulder pain. That's okay, let's just screen it. I did fucking every fucking test under the sun. This, instability test, this, nerve, this, compression test, plus flossing. And he was like, half an hour of test. I said, of course, bro, we're trying to get down. It's not just I have pain here.
Yeah.
You have your rotator cuff, you have a biceps tendon, you have your ligament, you have your GH joint.
You have your brachial plexus, everything.
There's so many things that go into it. Are you getting numbness and tingling down the hand? Oh, you are? Okay. Is it going to these fingers or these fingers? Is it not going to these fingers? When is it happening? There's so many things that we have to roll up in our head.
There's the cogs are constantly turning.
And then when we're also trying to educate a patient on it and make it simple, right? Not overcomplicate. Oh yeah, you're having a compression, a double crushing from here and there, and that means this and this and this and oh, you might need surgery. Like it's a way of how you present it to the patient. Also, we're trying to take the stress off you. I had a patient the other day, right? Lovely guy. He's been watching for years. Honestly, a really good patient, and bit of an Achilles pain. And recently he's been his Achilles been popping a bit, right? And I remember speaking to, I think the surgeon's name was Rupinder Diol. I think that's his name, Mr. Rupinder Diol. I think he's an ankle surgeon. Don't quote me on that. I'll check my phone later. And he said to me, because when I done my ankle, I had bilateral ankle bursitis going on, horrible. And I said, oh, my Achilles are clicking. He goes, look, watch it for another 2-3 weeks, because sometimes with the Achilles being a bit poppy, it can be indicative or like a precursor to like an Achilles rupture, right? When I heard that, I shat myself, right? And then I chatted to my client again, really good client of mine. And then I looked at him, I was like, bro, because I know you. I said, I'm not going to tell you. I'm not going to tell you. And he goes, what, is it close to rupture? And I just smiled. And then he messaged me 2 nights later. Bro, I'm best stressed, man. I said, no, bro, don't stress. You're gonna be fine. Like it's not near that. We're not at that stage or phase yet. But again, it's managing patient outcome.
Exactly. It's the way we explain things, and this is like a heavy thing that we were taught, is that not using like nociceptive, is that the word? Nociceptive words, which is basically words that scare the patient. So I've had people like, okay, especially like the older population, they come to me like, yep, my GP told me I've got osteoarthritis. I was like, cool. Do you know what osteoarthritis is?
Yeah.
Has the GP explained to you what osteoarthritis is? They're like, no. Osteoarthritis to them is like the world's worst.
Yeah, game over. Everything stops. Yeah.
They're like, oh my God, my life is over. But again, just a simple explanation can just change everything. And it's like, this is why communication is a massive thing in this. Like, I might as well get an English degree as well. Like, the way we have to communicate with our patients and keep them reassured at the same time is thinking about all the possible diagnoses in my head. Like everything in the room, everything when we're speaking to you, you don't understand how much the cogs are turning in our heads. We're thinking, okay, I need to rule out X, Y, Z. I can rule in this. I need to do this test, that test. Yeah. I need to ask this more, like this screening question, that screening question. Yeah. Like there's a lot that goes on. Yeah. And that's us doing our due diligence to make sure that your pain is coming from where we think it is coming from. Yeah. And then being able to treat and Then we have to basically be able to explain that to you, treat it, management plan, prognosis, everything. And that's all within that kind of...
And all your emotions in between.
In that 45 minutes.
But it's very rewarding.
It's so rewarding. And this is why, like, when people come to me like, oh my God, I could pick up my kid today.
It's the best.
Like, oh, I could do this or I could do that. Like, oh, I could walk down the stairs now. I'm just like, my toilet's on the top floor and I couldn't like... Do you know, things like that? It's just like, oh, like, this is why I'm doing this and this is why I'm here, and like I can't see myself doing anything else, and I've been like that since I was 16.
There was one time I was in the gym, and there was a client of mine, and he walked in, and so I was walking, he was walking out, and he's like, "Karen, give me a hug." So then I gave him a hug, and everyone's like, "Who the hell is this short, stumpy Asian guy hugging this 6'3" English guy? Who the hell?" And he's like, "This guy's the man. He fixed my dad. He fixed my mum. He fixed me. He fixed my wife. He done this." And it was that moment for me was such a nice moment because everyone was like, who the hell is he? Who the hell is he? And I remember the lady was taking me around the gym because I was joining it. And everyone was like, oh, Karen, thanks for that. You saw my dad last week. And she was like, who the hell are you?
Memories.
I did. I said to her, I was like, see you later, don't worry. Yeah. Anyway, we were sitting down and then she was signing me up. And then another 2 clients go over. She was like, right, that's the 7 people that said hi to you. Who the hell are you? And I said, look, I'm no one. I'm just me, but I do this. This is what I do. And then she was like, I've heard about you. And it was such a nice feeling.
Such a nice feeling.
Whoa, like, and she goes, yeah, my boyfriend's grandma came and saw you, this and this. And then she remembered the name. And then I was like, oh my God, yeah, the lovely lady, like this and this. It's
so nice.
It's the best feeling.
It's so nice. Because I work right now in like a community clinic, and like because it's a community clinic, like obviously the concessionary charges are a lot less. Like I'm doing this again, obviously to get my hours, but because I want to help people that can't actually, afford private practice. That's what I'm doing at the moment. And I see all types of presentations and they're like ringing in like, oh yeah, can I book in with Sonali? And half the time they can't even can say my name. Yeah, but it's okay. I'll let it go. But it's just things like that. Like the reception starts to tell me like so many people have called in just asking for you. And obviously I only work certain days and it's so rewarding. And even like the graft of like doing my own private business in the midst of like having to pay for uni and stuff, I'd go to people's houses. You know that life. Dragging that bed in a 3-door car, mate. I can't wait for that to stop.
I hate it.
But that
flight of stairs.
Honestly. So grafting and grinding, like I've been doing this for a long time, like mobile, like treatments and stuff from home. I never advertised or marketed once.
Yeah.
It's all been word of mouth. It's all been through referrals, and that is the nicest way I think to build. And I think like it's daunting for me because obviously I'm new here. People don't know anything about me. People don't know how I work and how I treat.
But you've been doing this.
Yeah, I've been doing this and I have no qualms about how I see us like thriving in this now new setting, which is basically the beginning of something new.
I think when it comes to like private practice compared to like NHS or like clinic based, we have more time. It's more one-to-one.
Exactly.
You develop a relationship. And imagine if you're doing like, 40, 50 patients a week, how many relationships are you keeping up? Yeah. And, for me on the back end of it, like it can be quite fatiguing.
Yeah.
Like, you're speaking to patients, you're checking in, you're reading scans. Like, look, there's been days where I haven't responded back to clients. I said, look, if I don't respond to you in 24 hours, message me back. Because there are so many arms to what I'm doing. Patient notes, treatment mapping.
They need to see the way the admin line's ringing.
Yeah. That is going crazy. And then I've got family life, home life, team life, stock, management, clothes, this, Jacob. Got so many things going on. And I find it so amazing how like you still have the drive after doing this for like the 8 years that you still want to help people the same. And even till now, when like, let's just be real. Sometimes there are patients that came with a higher expectation and didn't achieve that in the first 1 or 2 sessions. That's fine. It was a really hard pill to swallow when I realized you cannot help everyone.
No.
And it was so heartbreaking because I was like, I'm just trying to do my best. But
that's all you can do. Like doing your best is all you can do.
Yeah.
Right?
And it's honest, even now when like, for example, when I see a patient that may have dropped off, like, what happened? And I'll ask them, I haven't seen what's going on. Was I not good enough or what's going on? And they're like, oh mate, yeah, it was fine, but I still having pain after 2 weeks. But I'm like, you only had 2 treatments in. You've torn your biceps tendon. Heal time takes X amount of weeks. There's a reason. But then I said, look, that's fine. Maybe I wasn't the right practitioner for you. Maybe you needed one of these Insta massage therapists just to wreck you and say, oh, this is rotated and this is rotated and this is rotated and this is rotated and this happens and this happens a lot and all the way up. But that's not me. I'm not gonna give you bullshit. I do see a lot of guys on social media that will be like, oh, your ankle's tight, then this rolls in, then this happens, then the hip goes, then the lat goes this and this goes. Come on, man. If you don't know anything about building a house, and if I tell you, oh, you need to do this and this and this, you're gonna believe it because you know nothing.
Of course.
Just like the average Joe public, when they come and see us, maybe they've seen stuff on Instagram, they may not know what we know. And if someone can say something with enough confidence, people believe it.
Exactly.
And in the industry, that's my biggest ick.
I agree.
When I see guys on social media, like, look at this guy, 150k followers, this and this. He's just pressing them really hard and telling them this is because of this.
Or they're scraping them really hard, cracking them really hard. Like, honestly.
Oh my God, cracking them really hard. I had a patient the other day. I said, have you been manipulated before? And they were like, no, I haven't. I'm really scared. I said, why? They said, oh, on Instagram, it's like bang, bang. I said, listen, I will do such a gentle manipulation. You're not going to even know. Literally grabbed it, light rotation. And they were like, oh, is that it? Yeah. I said, it's not this bang, bang, thank you, ma'am kind of thing. It's an understanding. All that stuff is bravado.
It's clickbait.
Clickbait, bravado. Look, we've done it in the past, yes, because unfortunately that's what
gauges.
That's what gauges.
Audience.
If I can gauge, look, if I do a cracking video and that's going to get you to see the page and you're going to be like, they actually deal with this. Oh, they deal with this. And then, because on our page, there's not many cracking content. There's not much minute content there. But unfortunately, the way social media is, we have to create the content to get the people in and realize, actually, do you know what? I don't need to be cracked. I've had people that come and see me and be like, oh yeah, my usher down the road, he just used to crack me, but I don't feel any better. Can you crack me? What difference does it make if I crack you, she cracks you, or the chiro? No, let's not talk about chiros. If I crack you, she cracks you, or somebody else cracks you. It's the same technique, right?
It's literally.
And they're like, oh yeah, but maybe you could get in there a bit deeper. No, mate, I'm not gonna.
One word: education. Literally, if the moral of the podcast is education. Like, we are here to tell you facts. We're here to be straight up. We don't bullshit.
Yeah. Don't beat around the bush.
Yeah.
And I think that's where a lot of practitioners, they try to be the, oh yeah, I can fix that. Oh yeah, we'll just crack it. Or we'll just do this. And then 6 to 8 treatments better. I'm no better.
Yeah.
And I think, like you said earlier, manipping is great, but you can't base that split second on an overall treatment.
Yeah.
And I remember when I was learning back in the days, my lecturer, he said to me, don't make people into crack addicts. I said, I'll be a very rich man if I make people into crack addicts, that'll be great. But he goes, yeah, because obviously how it works in the brain, lights up same senses as sugar and cocaine and blah, blah, blah. We know it has a endorphin and serotonin response as well. And
that's why you feel good after the crack, but it doesn't mean that it's adjusted your spine or anything.
No, yeah. Oh, bloody, realign my spine.
Oh.
No.
Have a day off, mate.
Yeah. Nothing's getting realigned. If you're getting realigned, you're having surgery, you're under general anesthetic, and they're actually putting it together. Hips are not out. My spine doesn't need to be re-put into position. My shoulders don't need to be realigned. The reason why and I'm going to go on a rant. The reason why this happens after therapy is because we've had a visceral response to the body. The musculature, all the muscles that have been tight have learned to ease off. We've caused a relaxation effect. The mechanical receptors skin have eased off. And that's why my shoulders feel a better aligned, or this and this. But nobody in the world can realign your spine, can re-level your shoulders and this. To re-level your shoulders, you need to see what muscles are working well and not working well, strengthen the ones that are weak, and ease off the ones that are overactive. That's how you fix that. And a few other bits and bobs. But again, I'm going to go on a big rant. All my hips out of line. Do you know how strong that hip joint is?
It's the most congruent joint in the body.
That hip joint, your IT band is responsible for having 300 kilos of pressure into your hip socket. So when you go in there trying to foam roll the IT band or get this guy to elbow the IT band.
Foam rolling is a whole different story.
It doesn't do anything because you need the hips to be tight. The hips are the shock absorbers. You don't want to drive a car with loose absorbers because you hit a pothole and it's gone. Same with the hips. They need to be solid and strong so they can handle the load. And if they're not solid and strong, the load will shift elsewhere. Lower back, front of the hips. And then that can have a bit of a knock-on effect. But please, no one... Make this into an advert, Jacob. No one is realigning the spine in the world, or your hips are not out, your one leg length discrepancy is not true. Yes, I believe in that when I was younger, when I was early in practice, but experience has showed me that's not the case, and we are not going to feed you bullshit. Fucking hell. Oh, man. Oh, man.
Take a breath.
Need some water. Oh, God.
But yeah, moral of the story is we don't feed you bullshit.
No.
We spit facts.
Yeah.
And we're going to continue spitting facts.
We're just here for the real results.
Yeah, that's it.
That's what it's about.
Exactly. Now with a little bit more impact on women. Yeah?
Yeah.
Again, to round this all up, the reason why we have created Primal Women's is because we want to create a safe environment for women. Just because you have, it doesn't have to be a women's health issue. Yes, we deal with a lot of pelvic floor dysfunction, pelvic girdle pain, pregnancy-related pain, incontinence, urinary fecal, diastasis recti, all that kind of stuff. Yes, I'm happy to treat. I love treating that. But also, if you're a woman who, in this man's world, does not want to be treated by a man, I'm fully competent in MSK, in neuro, in Pilates,
Yeah.
All-rounder. And again, I'm just here to help you and to listen to you and put all my attention on you.
100%.
Rehab as well. How can I forget rehab?
That's the best.